My name is Tim Soucy. I'm the Public Health Director for the City of Manchester. More importantly, I'm one of this great city's sons. I was born, raised, educated, and now raising my own family in Manchester. As a child in the early 1970s, I lived in a three-decker on the corner of Amory and Rimmon Streets on the city's west side. A neighborhood where we played kickball in the alley and slid down what seemed like the sides of mountains in Lafayette Park, where the old French ladies would yell, "Va-t'en chez vous," or "go play in your own yard." This is the same neighborhood where in 2012, Manchester police officer Dan Doherty was shot 5 times and left for dead. This is the same neighborhood where in 2013, I was called out one night by the DEA and other first responders to a meth lab, where meth was being cooked up on a pile of children's toys in the basement. Tonight, I'm not sure the kids in my old neighborhood or in other distressed neighborhoods in Manchester are well. But I have hope. I have hope for the kids in Manchester's neighborhoods. But more important than hope, I'm in a position to do something about it. 2 years ago, we began the process of developing a neighborhood health improvement strategy. This innovative approach brought residents, policymakers, providers, and funders together to think differently, to think about how we implement a collective impact model to change the trends that are currently going in the wrong direction in Manchester. So what's different this time? How will we reverse the trends? We're going to begin by creating a healthy home system so every child has a safe and healthy place to live, by ensuring that children and families have the support they need for a healthy start so that they are ready for that all-important first day of school, by providing care coordination to help families navigate our systems to obtain the services they need, and by providing access to primary care and mental health care in our elementary school settings so that a child's total health needs can be met. I know this won't happen overnight, but it will happen. As I've said before, now is the time to go big or go home. Thank you.
Good evening. My name is Anne Phillips, and I am the Director of Grantmaking at the Charitable Foundation. And I've had the great privilege of working with Tim and other members of his staff for more than 15 years now. And so I know from this experience that they have what it takes to not just come up with the big ideas, but to actually make things happen. So when I sat down with Tim and his team to talk about ways we could begin addressing some of the troubling trends we were seeing in Manchester, using the kinds of comprehensive, neighborhood-focused programs that he just described, models that, as Dr. McAfee has shared with us, have shown such great promise in other parts of the country. Like Tim, I knew that I was in a position to do something about this. Working at the foundation put me in a position to help connect these leaders to the resources they need to make something this big and this comprehensive happen. I knew that I was being presented with a unique opportunity for this foundation and for me personally to play a role in something really significant for this community. But we can't do any of this work without the generosity of our donors. And in this case, it has been largely through the vision of the advisors of the Lois Roy Dickerman Fund, who know Manchester very well, and who asked me, how might we begin to work more upstream? How might we invest in ways to impact the root causes of the vulnerability of the children and the families that we're seeing in the community? Understanding the potential impact of the work that was being done, they've invested significantly in it. We also can't do this work without our other funding partners that many of you know, like the Endowment for Health, Granite United Way, the Cogswell Benevolent Trust, the H&H Foundation, and the Dartmouth Institute. And together, we local funders have also leveraged investment from national funders, like the Robert Wood Johnson Foundation. And I am convinced that the work that is going on here in Manchester is going to continue to attract national attention. I know that Tim means it when he says it's time to go big or go home. And as you'll see in the video, they've already started. This initiative in Manchester is very exciting, and we at the foundation are very proud and actually quite honored to be supporting the city in realizing this kind of future for all of the city's residents. And we invite all of you to come along with us.
We're a majority impoverished community as far as the children are concerned. So when you see rates that are elevated beyond what's expected for a city our size, it's alarming. It's alarming to the policymakers, to the leaders, to the families.
Children of poverty come to school usually 2 to 3 years below what students are normally entering the academic world with. And a lot of our children either are, some of them are homeless, they may not have had breakfast. Some children have told me, I slept in a closet last night. So there's many challenges our kids are facing before they walk through the door every morning.
What happens early in a child's life determines the success of that child later in life. If we can make sure that a child starts to kindergarten ready and able to learn, then there's a high probability that that child will go far and go high, both from a health perspective, from a learning perspective. And we should really be concerned about this because we don't have many children in New Hampshire. There's a social imperative and an economic imperative that every single one of those children start to kindergarten ready and able to learn. The future of this state depends on that.
There's a lot of great initiatives going on in the city right now, and we're looking to harness the energy of all of those and get them to work more collectively. So we need the resident voices, we need the community group, we need the nonprofits, we need government, we need the funders to all be on the same page and involve them in a much bigger initiative across the city.
The neighborhood health improvement strategy is really a new way of doing work in the Manchester community.
It's about neighborhoods, and I think what's most important if we can design neighborhoods around schools so that they understand that this is where they can find help, the schools are safe, that's what's most important.
There's an old African proverb that says, if you want to go fast, go alone. If you want to go far, go with others. Well, we want to go with others, and this initiative is about people working together in a partnership, organizations and individuals. And that's why it's going to be successful.
The strategy is a way to look at how we're going to solve the problems differently than how we've looked at them before. So for instance, if a child isn't attending school, then maybe we need to look at a care coordination model to say, what does the family need to help keep these kids in school? What do we do to build social connectedness, whether it's resident leadership training or other components? So it's looking at evidence-based practices that have been implemented and successful and saying, how do we bring those to Manchester in a much more collective way?
Well, I believe that this is going to be a model throughout the state and probably the country for folks to understand how do we get to the families that don't have the ability to get out and understand what the health of their community is.
But we really have a lot of work to do, and it's about rolling up our sleeves, putting our agendas aside, and coming together in a very unified way to get the job done.
This linking of donors who have a real passion for investment and change in their community with the leaders in the community who are positioned to make that change, that for me is a great example of the foundation at its best, and we should be able to see, the fruits of that investment 5-10 years down the line in these children who will be better positioned to go on to live healthy and productive, very important productive lives.